What kind of dentists are choosing to co-own CFD clinics?
I think it's probably the question is what sort of dentists want to come and work with us, and then what kind of dentists want to co-own. I think we've worked very hard, and I think we've been amazingly lucky actually to find some wonderful clinicians. And I think that dentistry is a tough job. There's no doubt about it. It's a tough old job, and you're having to put yourself out there all of the time because it's not about great composites or wonderful implants, although that is very important. You're actually selling yourself and you're selling trust. That's what you're selling. So it's a very, very personal engagement. And I've had people come up to me saying, oh, you're trying to commoditise dentistry. And that's just because we're in a supermarket where there are commodities. The one thing you definitely can't do is commoditise dentistry. It's a personal relationship between clinician and the patient. And for me, when we interview, of course, they have to meet all of the clinical criteria, which is pretty stringent. But what we're also looking for is that X factor of kindness, empathy, and understanding that marks them, I think, out as somebody that you feel you could sit down and talk to and not be overawed by, or not be able to say, I don't understand what you're saying to me.
How does it work in terms of the breakdown of responsibilities between the clinician and Centre for Dentistry? Do they like not having to do their own marketing?
I wouldn't say they don't do their own marketing at all. The breakdown is, so we have essentially you've got a triumvirate relationship. So you have Sainsbury's in this one place that's creating the environment in which you can operate and giving you the facility to communicate and market to their customers. You've got Centre for Dentistry who come in and create a beautiful, well-fitted, kitted practice that's compliant, future-proofed, hopefully for compliance, in a way that it should be. And then you've got the clinician and the team themselves who, with our help, run that centre. I don't really want them to worry about systems or about having to order products or all of those. I think dentists today have got, for many dentists who run their own show, they've got to be so many things. They've got to be a business head, a lawyer, an accountant, as well as a clinician. So our job is to just try and take all those things away from them, but not away in the sense that they don't get involved with them, but they don't have to worry about them.